Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Prevent some infection. And it's interesting, the exercise that they talk about is brisk walking for 2.5 hours a week, which is that's what, 60, yeah, 60 to 220, what's that, 150 minutes, which is
It's not that much.
Minimum.
it's yeah, minimum, yeah. Mhm. Yeah. But the question is how many people actually are willing to pay that price. Although it's funny how so many people spend money to pay people to come in to exercise, teach them to exercise, when actually exercising is something that you can do yourself, but it requires discipline. And that's why they make so much money in exercising, because discipline is easy to talk about, but not so easy to do. Now, Dr. John Robinson used to talk about the importance of psychotherapy, and how that the interaction between the psychiatrist and the patient can do even more than medicine. But the problem was that medicine was easy to deal with because you spent less time, and therefore you could make more money. So as a consequence, psychotherapy is not as often practiced as it should be, perhaps, because the remuneration associated with psychotherapy is very time consuming and requires commitment. But exercise is one of the ways of addressing that as well. So, and you can see how more exercise might make more room for the psychotherapy rather than the medication, which has so many side effects. All of them have side effects.
I can always think of something else to do other than the exercise. when it comes time to exercise, I say, well, I don't know if I want to do it or not. But when I get started, it's all good.
Yeah, and I think it's all about your habits. And if you make exercise one of your habits, then it becomes natural. And that's food for thought. This is an interesting article that talks about how not only is exercise good for so many things, but how it helps keep your brain functioning.
Dr. Callender?
Yes.
Could you go back to the last article? Because I was
Sure.
trying to take.
But don't forget, Liz, that this is recorded, right? So you can always go back and get it. Yes.
Okay. So what number do I call for recorder? Can you tell me that at the end?
No,
Yeah,
it'll be on your email.
They'll send
There'll
it to
be a
you.
link. Yeah, there'll be a link in the video for the video on your email.
Okay.
Oh, fantastic.
Okay. Why
Fantastic.
don't you go back to the article and let her see what she wants to see?
She just wanted to take a picture of it.
No.
No,
I want
no.
to see.
She wanted to look at something. What did you want to see?
Okay, I have information. Okay, was that, okay. Is that, go back to the top of the article. What's the title?
Exercise is powerful medicine for depression.
Yes. Okay. Thank you.
Okay, you're welcome.
That's your area of expertise, isn't it, Liz?
Well, no, I do health and wellness, but that is a main component. But
Right.
for myself, I have a routine,
Mhm.
and that I've kept, that I started before COVID, and I continued as on Zoom through
Mhm.
the Washington Senior Wellness Center, through the
Ah,
Wellness
okay.
Center. And so I know the group, so that's my socialization, and I'm familiar with the trainer, and it's just wonderful. And I do an hour each day,
Wonderful.
except Sunday.
Wonderful. Good. That's a good way to live, have a long life. Okay. So we were talking about how this affects the brain and how all of the things that you're doing with your exercise turns your brain into a pleasure powerhouse. What that means is that you have these epinephrines and norepinephrine and other dopamine, serotonin, and others that make exercise, makes your brain like doing what you're doing with exercise, just like you talked about how you have used your exercise and that has become a very positive experience for you. And that's a consequence. But it all boils down to the issue of you having the discipline to decide that that's worthwhile doing, and then making that a habit that you do. You know, in life we are what our habits are. If our habits are good, healthy, and soul generating, then it works in our best interest. Uh, there was Dr. Tenson talked about soul genomics and how the cells are positioned to take advantage of good thoughts and positive experiences to help us live long and enjoy life. This article says that the neurons also recreate and duplicate, and so that the neurons become healthy. And then memory and learning improves as well. And then the cerebral cortex becomes even thicker, which is good for you. It's interesting how all of these things relate to exercise, and then of course the last thing is it improves adaptability, ability to adjust to whatever comes forth. And in this life today, there's so many things that come forth. So, and you see here, this is 2 hours and 2 hours and a half here, which is the same thing that they talked about in the other paper. So it's so good for us that it's something that all of us should do in whatever way you can do. Because some people have arthritis and joint pains and other things like that. And we learned that exercise affects arthritis as well, improves arthritis as well. So exercise is something that helps you to live a longer life and a more useful life. Any other comments about that? This article, the other article. That's the positive part of it. Now we look at how life expectancy has dropped by 2 years because of the pandemic. And it's interesting that that's not surprising, because we lost nearly 1 million Americans and 6 million human beings. So it's not surprising that the life expectancy has gone down. In the United States, we have fallen behind, and What do you think is the major reason? Probably obesity and lack of exercise and the food we eat.
Yes, yes.
So
Well, I think the major reason we got affected by the pandemic is because somebody named Trump eliminated all of the research that we had done in the preparation for a pandemic that was in place when he was elected.
he did that because Obama did it. I mean, come on.
Exactly. That's what I'm saying.
How could anything come from Nazareth or come from a black man? So that was his problem. We suffer for it. We suffer for it. Yeah.
The whole country, you know, not just black people, everybody suffered for that.
Right. That's right.
Still suffering.
Remember, he denied that they even had a plan for it until they forced him to recognize the plan was there. He just didn't take advantage of it. This is a frightening study here. We talked about plastics and the fact that plastics are everywhere. Now this article is finding it in the lungs and the blood and everywhere we are, it's plastics. And so we got into plastics thinking it was a good substitute for glass. And now we are becoming plastic. And that's not a good thing. So it's the only question is at this point, what can we do about it? And how can we reverse what has already taken place and our reliance on plastics?
Yeah, recycling is a good method of eliminating a lot of the plastic. But you know, as a scuba diver, you know, I'm down, you know, 200 feet or 100 feet in the ocean, and I see plastic down there, and a lot of marine life eat the plastic thinking it's food, and we eat the fish that eat the plastic. So we only it's kind of frightening, to tell you the truth.
Yeah, it is. Yeah, we're killing ourselves here. Yeah, we're contaminating the earth that God has given us, and of course we're getting ready for World War #3 as well. So that's going to be another awful thing. So it's amazing what we're doing with what God has given us.
We are what we eat.
Yes.
Yes.
Yeah.
We are what we ingest.
Yes.
Yes.
And it's interesting. Your point says that whatever we ingest is ingesting plastics. So it's not a good thing. It's just unfortunate that there aren't more ways of eliminating this, even though it's pretty late.
11 out of 13 cases.
What's that?
Oh, I was just reading where it says 11 out of 13 cases.
Yeah. Yeah, and it's very very frightening, especially when it comes to the fact that the lungs are, yeah.
I have a question.
Well, what is, yes.
The question is about the lungs and plastic. We're getting this plastic by are we breathing?
Yes.
Microplastic
Yes.
pollution. Okay.
Yes, we are. And we don't even realize it because they're small particles.
This picture is an exaggeration.
Right.
That's
much smaller than that.
Much microscopic.
Right.
Dr. Callender, will the mask help in this area here?
Actually, yes.
Wow.
That's one solution. And
And
of course, we'll talk more about the mask later too.
And I noticed that a lot of people, when I was teaching, would go to the microwave and put a piece of plastic over their food when they warm it.
Right. Yeah, and there are many ways we consume the plastic and don't realize it. Yeah. Now this is something that is a new phenomenon, Zoom fatigue, because everything is Zoom now. And because of that, people are getting tired of Zoom. They also have, we talked about the headaches and neck aches and other things that occur as a consequence of the Zoom phenomenon. And then people always want to respond to their to Zoom and to emails and other things, and so the constant eye concentration is bothersome to the mind and to the eyes. And they talk about ways to combat it. And these are some of the things, they itemize some of the things. And I think that all of them are possible. The question is, when you switch to email, does that help? But the other things seem to make sense. So phone calls now become less and less common, but they're much healthier. But it's interesting, the phone call is much more effective because it's communication both sides, whereas email is one-sided. Of course, you get a response, but the response is delayed. And with the phone call, you actually have communication between two people in a very timely fashion.
I love that. I love that. Because most of my, when I work with, do consulting with family, friends, and neighbors and health and wellness, it is by phone. So I love that. Thank you. Thank you, Dr. Callender.
Welcome. And unfortunately, it becomes less common, but it is very desirable. And I'm glad that you have recognized that and use it in your practices. Sometimes we get so reliant on emails that we forget that that's not the most effective communication.
Right.
I put this in because there are people among us who actually have been on dialysis and some are still on dialysis. And one of the concerns was how COVID related to mortality in the dialysis patient. And this article, in some, identifies that the mortality rate in dialysis patients from COVID is higher than in other people's. It's not something that we're unaware of, but it's important to recognize that it's even more important for dialysis patients to be vaccinated than it is for other groups. They fit in the category of the immunosuppressed because renal disease and dialysis makes you immunosuppressed. And as a consequence, the mortality rate, as you can see in these figures, very high. Now you see a p-value is 0.00023, and I just point out that the p-value that makes things significant is just 105. So it's here you have 1, 2, 3, 4, 5 zeros. So that shows you how lethal COVID is in the dialysis patient. And so the dialysis and the transplant patient becomes very important for them to be vaccinated.
Dr.
Because,
Callender, I have two family members that are immunosuppressed. One is a diabetic, one is a kidney transplant patient. And both of them now are having problems with low blood levels. Both of them have been vaccinated, both of them have been boosted. Their
low blood level meaning what? When you say low blood level, what do you mean by that?
blood level being 3, I don't know what's the norm, and the other said his blood level is 7.
Are
The
you talking
one
about
that,
hemoglobin? Is that what you mean?
yeah,
Okay.
yeah. And
Well,
one, the transplant patient, he had a kidney transplant years ago, but now he's back on dialysis. Both of them have lost a lot of weight. The diabetic, he has a medical background, and he says his blood level has gone to 7. I don't know what the normal range is.
normal
And
is 10,
It's
10 to
10.
11, 10 to 10 to 14.
Okay, and the one that's 3 is the kidney transplant, and he's on dialysis again. I don't know if it means that he'll have to have another transplant.
Oh yeah, he'll have to have another transplant. One of the things that the kidney does is produces a hormone called erythropoietin that increases the hemoglobin. And so when your kidneys stop functioning, anemia is one of the commonest side effects, because that hormone is no longer produced, and therefore you have anemia. And so those patients who are in dialysis, unless they get erythropoietin, which is commonly given to dialysis patients, so that they don't stay anemic. And so that becomes an important part of the treatment plan for dialysis patients.
Yeah. And
Yes, go ahead.
a few days ago, I tested positive for COVID.
Okay. Breakthrough infections common, and the question is, after you get a breakthrough infection, do you still need to be vaccinated? And a lot of the information suggests that the breakthrough infection is a vaccine in a sense, because when you get the vaccine, you don't die, you don't have to go to the hospital, but your immune system becomes powerful. And for that reason, most people feel if you get a breakthrough infection, the need for the revaccination becomes less critical, because you become hyperimmune as a consequence of the infection. So the question is, do you need another vaccine after that? Well, maybe in 6 months, but usually it suggests that really takes the place of the vaccination. But there's been a lot of debate and discussion about that. And I'd like to hear some thoughts on that. I know, John, you've had both. So any thoughts that you have on that?
I thought about it afterwards. As soon as the second booster was available, I rushed out and got it. But since I had COVID in December, and this is just April, I might have waited at least a couple more months before I got the second booster.
Yeah.
So
So
a
getting a
time
booster right
frame?
after you get the COVID is not, breakthrough infection is not necessary.
Is there a time frame after having COVID
4 to
before you
6 months.
get the booster?
4 to 6 months, probably. Most people, when they look at the data, they say no earlier than 4 months, and between 4 and 6 months.
Dr. Callender, is that the same for kids younger than 5 years old who have come down with the virus? Is their immune system also elevated so that they will be less likely or to come down with the virus?
Well, I think the more recent studies have demonstrated that there's still a time frame, usually about 3 to 4 months, but the vaccine has been shown to be very helpful in raising the antibody titer level to those people who are in that age range that you mentioned. There was a study that just came out that talked about the fact that the booster shot was very, very helpful in that category of patients.
Okay, thank you.
But so far for a 3-year-old, there is no vaccine, or has that been
That's
approved
correct.
yet?
That's correct.
Because whatever happened to time frame with mine, I have a 3-year-old niece who also became positive for COVID.
Oh, yeah. Wow. Any other comments or questions about that? Otherwise, this is an interesting, long article that talks about one area in the country where they really stuck to the quarantine. And that was an area in Colorado that was able to avoid the enormous lethality that occurred with most people who got the Spanish flu back in 1918. But they stuck to their guns, and they made sure that people came into town, if they were allowed in town, actually wore masks and did other things. And so this is an article that talks about the importance of sticking to their guns, which they did in this area, and it saved many lives. It's a long article though, and take time to review. But just like now, we are eliminating masks in some areas, and there's an article that we have that talks about that. But we pay a penalty when we forget the rules of the game, and the rules of the game are to not spread it, not give it, and not receive it. Any thoughts about the new situation in which we'll talk about a little later, about the fact that masks are becoming less desirable?
Well, a lot of people are getting tired of wearing them. I'm tired of wearing them too, but I can consistently wear them when I'm in mixed company.
Yeah, people who are not vaccinated, it's important. And I
Well,
think you don't know who's not vaccinated. So
yeah,
Right, just act like everybody's not vaccinated.
yes.
that's right. That's the
Yeah.
safest way. Unless
Well,
you're in a group, like for example, I have a medical class and everybody in the class is vaccinated. It's required. So, but once you get out of a controlled group, then you don't know what's going on. So, wearing a mask, they call it one-way masking. And the article we'll read later talks about the benefit of one-way masking.
well, the thing is, you have to make a decision. Do you want to be 6 feet distant apart from your fellow citizen, or do you want to be 6 feet under?
That's the decision. That's right. That's the decision. Okay, let's go to the next one, because that one's unending. It talks about other things. It talks about seances and those other things, which are interesting. But now this article on glass wearers is very interesting, because it suggests that because people who wear glasses, it prevents the virus from getting in the eyes. And that's a source of infection of the coronavirus. And many were not aware of that, and they thought the contact lenses would do the same thing. But the data indicates that contact lenses are not as effective as glasses in terms of protecting you from the coronavirus. And of course, that's why in the operating room, we always wear protective gear on the eyes, as well as the nose and mouth, because that's a way of getting infection from virus and blood and other things. So goggles should be part of the armamentarium of those people who can get exposed to the virus. Any questions about that or thoughts about that? I put this in here because I thought it was good for you to get an idea about why some doctors lose their licenses. One of the things that's happened over time is that the boards now have people on the board who are not doctors. They could be nurses, who are social workers, they could be just consumers, people who are patients. And this is an effort to make sure that the doctors, healthcare professionals don't lose sight of the fact that they've got to respond to all levels. And one of the commonest areas that is associated with doctor misconduct is boundary issues. Doctors having affairs with their patients, so forth. And this is among the top 3 reasons that doctors are disciplined. Unprofessionalism is a course actually that I teach in medical school, because this is one of the commonest ways people lose their licenses. And unprofessional conduct is many things. Sexual misconduct is just one of the things. Failure to meet standard of care, prescribing drugs inappropriately, dishonesty of any kind. And if you're convicted of a felony or fraud, or you don't keep your records appropriate. Alcoholism is another one for which, and one of the things that becomes an issue is the fact that mental illness is also something that becomes a concern which should be reviewed, and mental illness should not be something that causes you to lose your license. And actually reported patient complaints are the substance for which many doctors lose their licenses, but they have to file complaints.
I have a question.
Yes.
When doctors lose their licenses or their license to practice in a particular state, could they go to another state and practice?
They could go to another state and apply for a license. And usually if a state finds that you have lost your license, in another state, they will not grant you a license.
Okay.
Now, suppose they lie about it and they don't admit it. If they do not do their proper investigation, because now they have a database, a national database that records violations, so that if, for the most part, the national database will identify doctors who have been unprofessional and have lost their license. So that's another way in which doctors who have misbehaved can be picked up on.
Yeah, there are some instances where doctors have lost their license to practice and they go to another country altogether. I remember one Dr. Swagger went to South Africa after he was banned from practicing in the US. He went to, to some African countries and started practicing.
That's right, you're right. In another country, you could get away with it. Yeah. But not in another, usually not in another state in the United States, but in another country. Yeah.
With the exception of the article we had last week about the doctor working on the Indian reservation.
What is your comment about that?
Remember the doctor that worked on the Indian reservation, he went from Indian reservation to Indian reservation, still practicing.
Oh, yeah, that's right. Yeah. But if this, wherever the Indian reservation, it's in a state. So that state he still has to be licensed in the state.
Right, until he was caught and they
Right.
found evidence.
That's right. Yeah. Now this is an article on if you've got COVID, when can you have elective surgery? And there hasn't been a lot of data on this subject, but this article suggests the anesthesia suggests that 7 weeks, 6 to 7 weeks after COVID is the time frame that is desirable. Actually, they identify it as 7 weeks after you've overcome the COVID is the time when it's safer to have elective surgery. Before then, the mortality rates are considerably higher. And this is so that if you have had COVID and you want to have elective surgery, you would know that you need to wait at least 7 weeks before you would even think about having elective surgery. Recognizing that the risk then is much less, although there are those who suggested anywhere from 4 to 12 weeks, but the final conclusion was that 7 weeks was the minimum period of time that you should wait.
Dr. Callender, how do you define elective surgery? What does that mean?
Surgery that's not emergent. Elective surgery is planned surgery that you can get at any time. So you don't have to have it. In contradistinction to urgent or emergency surgery. Emergency surgery is something you have to have or else you'll die. Urgent is close to that. You need to have it as soon as possible. And elective is you can have it anytime.
Thank you.
Dr. Callender, does this article take into consideration people who are transplant recipients? Do they still fall under this guideline?
This does not address that. This
Okay.
addresses the garden variety patient who has recovered from COVID.
Okay. Thank you.
Benny, did you have a question? Oh, okay. Now, this is just an article that tells us there was somebody who said that, it was Thomas Edison, who said that what we know is a drop in the ocean. What we don't know is the ocean. So sometimes we think we know a lot when we know a little about a lot. And so this is a new disease that may be coming upon us that we do not know anything about. This just lets us know that as much as we think we know very little. But it's a lot more than we used to know. I think that's true about it. So I think that's the importance of this article, that's all. And as they do more studies, they'll find out, hopefully they'll find out what is the actual cause of this hepatitis. Right now, we don't know. So. Let's go to the next one. This is the article that talks about 5 to 11. The booster shows a strong immune response. But as you mentioned, that category under 5, we don't really have a lot of information on, have no information on. Yeah. But above 5, it works very well. Okay, let's go to the next one. This it's interesting. The question is the US underselling, overreacting, and there's probably a little bit of both. We've had increases in infections, particularly in the unvaccinated. We have infections in the vaccinated. The only difference is the infections in the vaccinated have not, for the most part, resulted in death or hospitalization. But we've had a number of breakthrough infections because this virus, this variation of the virus, is more transmissible, more easily transmissible. Not as lethal, but more transmissible. And if you're not vaccinated, it can be lethal as well.
Dr. Callender, I think one of the biggest concerns is all the rapid testing that people have. I don't think people are reporting like Janice was saying. If she got COVID and tested at home, you know, what would be the need to report it to anybody else? I think a lot of the positivity is unreported.
Which is a
That's
problem.
true, because with me testing at home, as soon as I got it, it was like, okay, what do I do next? So I called my doctor, and do I have to report it to anyone? And they said, since I've been vaccinated and boosted, quarantine for 5 days and then test. And I guess after that, I'm okay, but nowhere was it reported officially.
Mm-hmm.
Which is John's point, which is,
yes, exactly. Yeah. Mm-hmm.
And which also means that there are people, unlike you, who get a positive test and do nothing about it. And there's no way of following up on it, which is problematic. It's a good thing if the people who get the tests are responsive and responsible. If they aren't, then it's a problem.
Janice, can I ask, were you out and about, or in terms of how you caught it? Do you know how you caught it?
The only thing that I can put it on, I had a fish fry on Friday, and I have this thing about my bubble. So the same group that I'm around, like Thanksgiving and Christmas, those are the ones that I am around, they're relatives. And Good Friday is something that we normally would do. Smaller group, but we would have a fish fry. Well, it turned out my granddaughter had 4 or 5 of her classmates over. Okay, not really in the rules, but okay, we dealt with that. And then a niece came who I hadn't seen in a year or more, a couple of years. She came with her 2 kids. Now, I had to investigate with my granddaughter's friends. Well, they had to go back to school. This happened Friday. They had to go back to school. They had to be tested. All of them tested negative. So that ruled them out. So when I went to my niece to let her know, I tested positive for COVID. And I wanted to say, I didn't invite you, but I couldn't go there. And she said, oh, funny you should say that. I said, why? She went to visit her sister over the weekend out of state. Her sister tested positive for COVID a day or 2 later. I think whatever the source was, it was in her house. One of her little girls, I believe, had COVID. And I suggested that she test the kids. Whether or not she will, I don't know. Otherwise, I haven't been around anyone. So as soon as I found out I was positive, I'm in my bedroom and I'm here by myself. So, you know, I'm not making contact with anyone, but I do believe I must have gotten it from one of her children.
I see. So I guess, is it that when your protective bubble is pierced, you know, that opens it up, you know, for a chance of the virus to attack you?
That's my rationale. Of course, if you go to the stores and stuff like that, you can't help it. I always wear my mask. I'm always protected to a certain extent, But to be around a group of people, to me, it started with Friday. And then with my granddaughter's friends, they were tested. They're negative. Now with this niece and her two daughters, I believe that's where it was. But all I can do now is just quarantine.
And of course, you guys were not wearing masks in the house, right?
We're not wearing masks in the house. You have it, yeah.
What are your symptoms? What are your symptoms now?
Well, that's why I was surprised that I was positive. I was just extremely tired, which is not me. So tired until I wanted to lay down and take a nap. I refuse to do that. When I get up in the morning, I'm up. So I tested myself on Tuesday, positive. So my only symptom was just being tired. I wanted to sleep all day. I feel a little better today, but just tired. No headaches, colds, sound a little nasal, but other than that, I'm fine.
Okay, thank you for sharing.
Yeah, Dr. Callender, do you want to tell them about Asbury on Sunday, Easter Sunday?
Yeah, well, of course, yeah, we had another Easter Sunday, and actually, one of the things that bothered me a little bit is that it was pretty crowded, but it was a great service. The question is, what is the consequence of it? Because it's the first time that we've had a real large audience, and now another thing that I don't know if you noticed this, John, but there are a number of people in the choir, not just the soloists, who don't wear masks appropriately. They wear masks below their noses. And so the vulnerability for the rest of us is greater. I didn't realize it until I actually was watching, went back home and watched the service. And I saw a number of people in the choir who were not wearing their masks appropriately. Because the rule is that if you're the soloist, you don't need to wear the mask, but everybody else is supposed to wear a mask. And, I noticed there's about 4 people in the choir who were unmasked. Did you notice that, John?
I did, and one of them is a friend of mine, and he always comes up and wants to be real friendly, So I kept my mask on the whole time, but that was my first.
That's right, your classmate.
Yes, my first in-person church service in 2 years, over 2 years.
Yeah. But you're right. That I noticed him with his mask below his nose, and so the question is, what's the price we pay for that question? I don't know. And of course, John was there again with his timpani, and it was a great service, great music. How about Sylvia? How did your singing go?
It went okay. It went okay. Carol played for me. It was a Good Friday service. It was very good.
Was this in person or virtual?
It was in person.
How was the audience? Did they wear masks, or what was the situation?
Yes. The audience had masks on, and when I got up to sing, I took mine off, and when I finished, I put it back on.
Okay. Do they do social distancing there?
Yes, they did. They had the rows labeled, don't sit here, sit here. So it was like every other row. And this was at Mount Pleasant.
I was disappointed that we didn't do that at Asbury. I was disappointed.
It was wide open.
Yeah.
Well, I did go to my church on Easter Sunday, and people were somewhat scattered. Everyone had a mask on, and they enjoyed the service. That was the 8 o'clock service I went to, but I understand that the 11 o'clock service, they said it was packed. I was like, whoa, I missed it, but I got to the early service.
Yeah. Our early service was outside, and
Oh.
so it was nicer. I mean, it's less capacity for contagion.
Yes.
But you're right, at the 10 o'clock service, it was crowded.
Yeah. Ours
So
was
it's quite
too.
interesting to see what impact all of this and the timing of the mask business is going to have on the incidence of infections and of coronavirus in our country.
Yes, and last night I participated in the National Convention of Gospel Choirs and Choruses. They had a board meeting and it was in near Baltimore, and the choirs sang and nobody had a mask on when the choir sang. So
Really?
yes.
Mm.
So we'll see how things are. John
Yeah.
Tatum, are you there? Carol Tatum is there now.
Yeah, I'm still here.
Okay.
Yep. I just
Once they finished singing, everybody put the mask back on. But
mhm.
John, did they say the criteria was everybody had to be vaccinated?
Right.
Yeah, they did check your vaccination cards.
Mhm.
Yeah, I did a performance at the Kennedy Center on Saturday, and we all had to have vaccinations. Everybody in the group, crew, and everybody had to have vaccinations. But everybody had to keep their mask on during the performance, except for the vocalists and the horn players. And we had to have a negative PCR test within 72 hours of Saturday. And our sax player couldn't find his negative PCR result on his phone. They were going to make him take a test at the Kennedy Center, and they said it would take 2 hours for that to come back, a PCR, which is, I've never heard of that before, but he eventually found it, so he was able to perform. But I felt very good about that. And the audience, everyone had to have masks on. So and that was a success as well. We played it for free at the Millennium Stage.
Interesting life. Yes.
I have a question. When you get the virus, approximately what's the range of when you know that you have it? Is it 4 days later?
3 days, 3 to 5 days. Yeah.
Three to 5 days. Once you get the
Yes.
virus, you start coming down with symptoms.
Yes. 3 to 5 days. Yeah.
In my case, it was 2 days.
Okay. It's interesting that the CDC is recognizing that this variant is among us, and of course the area that's most critical is whether you've been vaccinated or not, and because in most cases, as we mentioned, it prevents you from being hospitalized or dying. But if you haven't been vaccinated, then that's different. And so what is the home card, so to speak, is whether or not you've actually been vaccinated. And so it becomes so important to be vaccinated, because people are dying from this virus still. And most of those who are dying are those who have not been vaccinated. Now, this is an interesting one, in that they've authorized, I don't know where you can get it now, but they have a breath test that gives you a result quickly. I think within minutes, under 3 minutes. And this would revolutionize things, because then you could just test everybody who comes in. Of course, I don't know how much it costs though. And look at the sensitivity and specificity is extremely high. And so it's going to be interesting, because this then makes it very easy to get a result. So you can tell me you're vaccinated, but let me do your breath test.
Dr. Callender, it's interesting how how we're evolving. You first the needle, then they talked about there was a pill, and now you're talking about a breath test.
Yeah. So I think this is going to revolutionize things.
I do too, because I think that the police officers need to carry those around, those who are out on the street, trying to catch speeders and et cetera. And they give them a breathalyzer to check to see what their alcohol level is. But
right,
a byproduct would be, well, you're not above the legal limit, but you do have the virus.
No, I don't think so. I don't think so. Because it's going to be an expense associated with it, which I don't think it's going to be cheap yet. Now, by next year, it'll be cheap, but I think now it's too expensive. Now, we're approaching that $1 million level. Yes, Dr. Atchell.
Oh, I'm sorry. Yeah.
Oh, okay.
Good morning.
All right. Now, this is an interesting article that questioned, to me, it's an obvious answer, but anyway, it's clear that nobody cares about Black people outside of, do Black Lives Matter?
Yeah, Dr. Callender, I was looking at the news and they indicated that it was not only people Blacks, but they were talking about all of the other individuals from other countries, especially the students who are actually there in Ukraine studying, and how they too have been mistreated. And, trying to get back home has been a torturous attempt for them also.
Yeah. It's really horrible. Man's inhumanity demand is sometimes unbelievable, and you wonder how a merciful God can allow man to be so inhumane to his fellow man. Well, now this is interesting, because what this means is that they still have a right to do things that are appropriate for the COVID situation. And as long as you have the health emergency situation, many of the things that are done, including that TSA thing, can be reversed as long as you have the Emergency Act. And so, and as the CDC determines that it's still an emergency. And so this is one of the important acts. And so having it renewed means that these actions that people take to overcome masks and other things are have a good likelihood of being reversed when it's taken to a higher level. Because if you still have the Emergency Act, then that may justify a lot of these things. So it's going to be interesting to see how it plays out in the courts.
I see that article was talking about millions losing their Medicare funding. I mean, Medicaid.
Oh, Medicaid, yeah, because they, as of recently, yeah, that's right. That's no longer, but I think the health emergency funding would help that to some extent, but it is clear that the funds that we had, the most recent congressional activity eliminated it. So it's going to be interesting to see what's going to happen next. Viola Davis, this is an interesting article that just points out that people who have fibroids and other things have trouble with vaginal bleeding and pain and other things that force them to want to have their uterus removed so they can live a normal life, pain-free life, free of other problems. And it's interesting how she communicated with her surgeon anyway.
That was funny.
She's been very.
It was funny what she said about the 20 years, what she said about, it's the paragraph right before that one.
Yeah.
Mm-hmm. She was talking to God. God, you haven't heard me in a long time.
Yeah. My name is Val.
I know you're surprised.
Yeah. And her wish was granted, huh?
Mm.
Yeah. That's interesting things that people go through in order to have health. Health is such a important commodity. We can't take it for granted, and we have to do everything we can to retain it while we can.
Yes.
Yeah. Well, it's interesting that all countries have been removed from do not travel list, which opens the door for people who want to travel.
It's all about the money.
Yes.
Yeah. Anybody want to visit any other country?
No.
I do.
Yeah, I had my son, he says, I don't care where it is, I am traveling overseas this summer. I mean, that's a millennial. So I'm like, okay, but I'm sure this has just opened the door for him. Like, I'm ready to go.
Yeah. Of course, the most dangerous place in the airport is before you get on the airplane, encountering all those people on the lines. I don't know. In the article, I don't know if you noticed it. It said they was going to appeal the TSA objected to that. Now this is a very, let's go back to the article you just left, a very important article because the other one, yeah. One-way masking, what does that mean to you? What it means is that if you wear a mask and nobody else does, That's one-way masking. And the question is, how dangerous is one-way masking? I think it is particularly dangerous when you are not on the airplane, because the ventilation is such that on the airplane is probably the most protected you are. But while you're out in the airport, you're surrounded by people who are not vaccinated. And you don't have the ventilation you have in the plane. But you're still, if you're wearing that N95, you're still okay. They downplay the importance of cloth masks and surgical masks, and identify the N95 as the one that is protective. And so if you're going to do a lot of this travel, probably need to take your N95 with you. And it says again that the filtering system is pretty good. It's before you get to the airplane that the problem occurs. I think it's a good article to review so that you can protect yourself against others, because some people are so anxious to get that mask away that they'll infect you. What are your thoughts about you and your children traveling? Anybody?
I think that when you travel, it increases your risk of getting the infection. So you're gonna have to govern yourself accordingly. Do you think it's safe going where you're going? And it takes extra planning. You plan where you're gonna go, you look at the statistics for that area, and then you make up your mind.
Notice the comment about using the filter where you sit to increase the filtration rate so that you're not exposed if possible. But yeah, that's right. It's risky, but what on this earth is not risky? Staying at home is risky. Leaving is risky. What is without risk? Nothing. Everything is risky. And I think you can't overestimate the importance of being vaccinated. Now, this is a horrifying article that talks about the incredible surge in teen overdose deaths, 14 to 18, 20% increase. Stay safe, Sylvia. Are you singing too?
No, I'm not saying.
Okay.
Okay. All right.
Right. But anyway, this is something that is frightening, that is bad enough for the older drug users. Yes. Oh, I thought somebody had something. But it's bad enough for the older adults, but the teenagers, this is really horrifying. And it looks like fentanyl is the lethal drug again. So what do you do about your teenagers? I don't know. I don't know what to do. Because when they put fentanyl into these drugs, the lethality increases. That was a drug that killed Prince and many others, which is a great
Dr.
drug.
Callender, what is that drug for?
It's a drug that's used in
Fentanyl.
anesthesia. It's a
Oh,
drug
okay.
that is used to put you to sleep, but they know what they're doing, so they, you know, when you stop breathing, they breathe for you in anesthesia. But this drug stops you from breathing, and if you don't have a drug to overcome it immediately, then you stop breathing and you don't wake up.
Okay.
And now they have fentanyl laced marijuana. So, so which is even worse. So, yeah. And just you know, these people under 18 who take these drugs and not having any thought about being laced with poisons like fentanyl. But it'll stop your breathing whenever you take it, no matter what it's with, whether it's cocaine or marijuana or whatever. Yeah.
They're highly, highly, highly addictive. The fentanyl is.
A lot of
So
doctors.
the question is, what are we gonna do about it? I don't know. It's all about, as somebody mentioned before, it's all about the money they make from these opioids. Once they get you addicted to it, it's over.
You know, they're still selling that spice stuff, the K2, out of gas stations in DC.
Really?
Yes. Go right up and buy it. And I mean, there are people just passing out on the street outside of these gas stations. And I mean, the government will find out about a certain package that is laced with this stuff, and what the I think they're coming from China, and they'll just change one side branch of the active chemical and put it back out under a different label, and they'll sell it again. So all these kids are like chemical laboratories.
Yeah.
You know, and they're totally addicted. You know, once they start, that's really it. There's nothing they can do. Yeah, my son was a victim of that.
Sad, very sad. Okay, I don't see a solution in sight. And you know, these days with the internet, you don't even know what your kids are doing on the internet sometimes. This is one of the most recent things is the Florida judge shut down public transit mass mandate in the United States. And of course, you read in the newspapers today that the CDC is appealing that. So it's going to be interesting to see what the courts do. The courts haven't always done the right thing, but since the CDC is appealing this, it's going to be interesting to see what happens. See at what level the court will restore the mandate. Because right now you can't get on public transit, at least before then. So time will tell. We'll wait and see. I think that the judge is wrong, but time will tell. Well, any thoughts concerning this as you travel?
Don't travel.
Well, I think it's important that one-way masking works. So it's important
Yeah.
that you get your
Wear mine.
N95 mask and go for it.
Yes.
But don't go for it without your N95 mask.
Oh.
You have to protect yourself.
Yes.
Any other comments? It's a lot of articles we've gone through, covering a lot of subjects, but subjects that are very pertinent to what you and I experience. Any other comments you want to make about any of these articles?
Just have to take care of our own selves. That's what all of it's saying to me.
Yeah, self-care. Self-care.
Yeah.
Self-care for ourselves, our families, our friends,
You have to do what's
and
best.
those that we're connected with.
That's true.
My comment is stay away from little kids.
You got it.
I think that's what,
That's tough.
that's what all teachers say.
That's right.
I got my second booster yesterday, so I'm taking care of myself.
Mhm.
I wasn't a second
And
booster.
stop letting people come in your house. That's what it is. Say no, get out.
Betty, how was the second booster?
I'm doing pretty good. My husband said his arm is sore, but he's always
Yeah.
a baby about stuff like that.
Well, I noticed that when I took my booster, I had a nurse that was about my age, which I love us, okay? And I always look for us everywhere. She says, make sure you drink plenty of water. Well, I have a schedule to make sure I get my water in. So what I did was added more water to my schedule, which means that if there's inflammation or anti-inflammatory in my body, I was flushing it out so that the medicine can do its job.
I'm not a big water drinker, so I have not had probably I know I haven't had the required amount of water, but I'm still not having any problems with my husband drinks plenty of water, but I
Well,
don't.
there's a certain part of your body that loves water.
It's not my mouth.
I always say, yeah,
I'm not a water drinker, but Sunday I was at my sister's. It wasn't a crowd, just 3 or 4 of us for dinner. Couldn't eat, but all I could do was drink water. I do not drink water. I'll have 1 bottle of water. It'll last me 2 days. And I kept drinking water. And then 2 days later, I tested positive for COVID. And the main thing the doctor said was hydrate, hydrate. So I keep my water. I've been drinking water, and that's all I can do. But it's just strange how it
just look out
happened.
for the plastic.
So I'm hydrating.
Watch out for the plastic.
I drink a lot of fluid, but it's just not water.
Yes. Well, water is, Dr.
Pepsi
I believe that water,
juice.
when I do the overall wellness, I always point out that water is a natural cleanser for the body. So that's how I look at it. You know, I look at what's good for the body.
Right.
Okay. So I try to stick along those lines. Okay. I try to stick along those, as they say, the perimeter of the body to make sure the area is covered.
Yeah, I always say, think water, drink water.
Kool-Aid is made with water, so I drink Kool-Aid.
Only problem with the Kool-Aid is got sugar in it.
Betty, don't get me started talking about Kool-Aid.
Only problem with
Tea is
Kool-Aid
made with water.
it's got sugar. Too much sugar.
and die, John, and die.
Mhm.
Die.
Your red
took-
dye
I'm
I'm
number.
trying to do better with water, but it's hard.
In 1972, I took Kool-Aid out of my house. And the reason why is because my oldest child was having some problems in school. And so I started analyzing everything she did. And I did a research article about the red dye in Kool-Aid and what it does. And I remember in college, we used to take the red dye and color our hair in college. So if it does your hair like that, you can imagine what it does to the inside of the body. So since 1972, I have never bought a bottle, anything related to Kool-Aid.
I was kidding about Kool-Aid, but I do drink it on occasion. I do have it in my house, and I do every now and then, but I'm a tea person.
Oh, yeah.
Hello, Dr. Callender. Hello?
Yes.
Yeah, I have one quick question for you. With regards to these medical practitioners, those who practice privately, are they required to have a minimum insurance premium, a minimum by the state government? Oh, but
No.
Are they required at all to have an insurance?
No.
They are not.
No.
Okay.
Only if you go to a hospital, the
Okay.
hospitals require it. But to have an office practice, is not required.
Okay. Thank you.
Yeah.
And by the way, are you at Howard University?
Say again?
Are you at Howard University?
Yes.
Are you teaching? Okay.
I'm still at the hospital.
Do you happen to know Dr. Murray and Dr. Heddings? Those were my mentors and teachers during my time in the 80s.
Mary is, I think he retired a long time ago. What was the other one?
Dr. Heddings.
Oh, Heddings, yeah. Oh, those are the giants of the genetic area. They both retired. Heddings and Murray. Those are the giants who led the way in genetics.
Exactly. Thank you.
Yeah, Burl Heddings and Bob Murray, I think. Yeah.
Exactly.
They were both incredible.
Those are the
mentors,
exactly.
mentors and leaders.
Exactly.
Yeah. But they both retired.
Okay, thank you.
About 10 years ago. Yeah.
They retired. Yes.
Yeah. But they're both giants. Both. Yeah.
All right. So my teachers and my mentors.
Yes.